As I introduce myself, my name is Yalini Balarajan and I'm Officer in Charge for Nutrition. And it's my pleasure on behalf of our global, regional and country office teams to present our 2017 annual results report today. So the presentation is structured in three parts. First, I'll give a very quick overview of the context in global nutrition. And then secondly, I'll highlight our results, focusing on 2017, which is our last and final year of the UNICEF Strategic Plan. And then thirdly, discuss some of the lessons learned over the last 4 years and how they're informing and shaping our new ambition for 2018 and beyond. Next slide, please. So our previous strategic plan happened at a time of transition when we as the global community saw the endorsement of the Sustainable Development Goals and our global commitment to these. Maybe I could have the... Oh. Can I have that? And Sustainable Development Goal, no hunger, is the central area where we focus our work on nutrition. But it's very important to note that nutrition is linked with at least 12 of these 17 goals. And so investments in nutrition will bring about dividends in other sectors, in health, in reducing poverty, in improving education and employment. So nutrition is both a marker and a maker of development. And for Sustainable Development Goal 2, sets out to eliminate hunger, achieve food security, and improve nutrition. And we together as a global community have set the ambitious target to end malnutrition in all its forms by 2030. And this is absolutely critical because when we look at the nutrition context, especially for children, we see the situation remains quite critical. There are over 150 million children who are stunted, who are failing to meet their growth potential. That's about 1 in 4 or 1 of 5 children globally. At the same time, 52 million children are wasted and continue to suffer from some of the increased risks of mortality and disability associated with that. And then on the other side of the spectrum, 41 million children under the age of 5 are overweight. And while we have been seeing global progress in stunting reduction, we are off track to meet our global targets. So business as usual will not suffice. And it was within this changing context in global development and in global nutrition that we engaged with our strategic plan for 2014 to 2017. And in nutrition, we worked in the following program areas with work in infant and young child feeding, micronutrient supplementation and food fortification, care for children with severe acute malnutrition, and improving our services to reach children and mothers in emergencies, and also supporting the enabling environment for nutrition. And of course, at UNICEF, drawing on our other work with sectors from health, WASH, education, etc., because addressing malnutrition requires that cooperation. So moving to the second part of the presentation, and here I'm just going to highlight a few selected results. And I urge you to look at our annual results report for nutrition that has a comprehensive overview, as well as some country examples. And I would really like here to extend a special thanks to our colleagues in our country offices who have made achieving our targets a reality. Some of the highlights in infant and young child nutrition, where we focused on improving the feeding practices in the first 2 years of life. And in exclusive breastfeeding in 2017, 35 countries have at least 50% of children under 6 months being exclusively breastfed, compared to 27 at the start of the strategic plan in 2014. With our work at UNICEF to improve and protect breastfeeding and having legal measures in place, Um, 86 countries now have these measures in place, compared to 64 at the start of this. And over this time, we have supported several countries to increase capacity to deliver infant and young child feeding counselling in communities, with 115 countries globally in 2017 now having capacity to do so. In the programme area of micronutrient supplementation and food fortification, 82 countries now have legislation in place that mandates fortification of at least one industrially milled cereal grain. And in the areas of home fortification with micronutrient powders, which are an innovation to reduce anemia and improve the quality of children's fast foods, over the course of the strategic plan, we have tripled the numbers of children reached. In 2017, reaching more than 15 million children aged 6 to 59 months with these micronutrient powders. And UNICEF continues to deliver vitamin A supplementation, a life-saving treatment. And in 2014, 2015, and 2016, reached over 250 million children under the age of 5. Our efforts at UNICEF focus on prevention, which is the most cost-effective. But when those measures fail, UNICEF provides therapeutic feeding and care for children with severe acute malnutrition. And over the course of the strategic plan, almost 15 million children have been treated for severe acute malnutrition. And you can see from this graph that every year we have managed to reach more and more children, and in this final year expect to exceed our target of reaching over 4 million. UNICEF, as the cluster lead agency for nutrition, has responded to 66 emergencies in nutrition in 2017. And UNICEF is there before, during, and after emergencies, and has supported in 2017, at least 65 countries now having an emergency or risk management strategy integrated into their nutrition plan, compared to 56 in 2014. And despite very challenging situations, the UNICEF has managed to maintain the quality of services to treat children with severe acute malnutrition, with more than 90% of these UNICEF-targeted children recovering. In the enabling environment, 28 countries have undertaken a gender review of their national nutrition policy within their national development cycle. 97 countries now have nutrition or information systems that disaggregate data by markers of equity. And UNICEF exceeded its target in authoring or co-authoring peer-reviewed journal articles and contributing to evidence generation to inform our policies, programs, and advocacy. So now moving to some of the lessons learned and how these have informed and shaped our next phase moving forward from 2018 to 2021. So firstly, we will place children, adolescents, and women at the centre of our programming and take more of a life cycle approach and move away from an intervention-based approach. Secondly, we will renew our commitment to the 1,000 Days Agenda, which we know where children are most vulnerable and where we can make most impact, and accelerate actions to improve women's nutrition during pregnancy and lactation, improve the quality of children's diets, which is a critical bottleneck for reducing stunting, and when these preventive measures fail, scale up our care for children with severe acute malnutrition in all contexts. Thirdly, we will put foods and diets at the centre of our advocacy and programming, and be very clear that achieving food security for children is absolutely critical and part of our mandate, and ensuring that food systems deliver nutritious, safe, affordable, and sustainable foods for children. And fourthly, be responsive to the changing realities of nutrition in children. We are now in a world where there's an increased number of humanitarian emergencies, which have increased complexity and have an evolving humanitarian landscape following the Grand Bargain and the World Humanitarian Summit. And we also have to accelerate our programs to reach school-age children, adolescent girls and boys, and also to support the prevention of child overweight, which we saw at the beginning was increasing. And lastly, a more practical lesson from our funding situation. While we benefited from the support of many partners, the majority of our funds in nutrition were earmarked. 95% of our funds were earmarked, giving us only 5% flexibility. But we have been extremely fortunate to start this next phase of the strategic plan with a very generous contribution from the government of the Netherlands that has increased our thematic funding, our most flexible source, by over 400%. And this will help us to improve our long-term strategic planning and, importantly, catalyze and accelerate results for children, adolescents, and women in nutrition. So looking forward, you may already be familiar with UNICEF's next strategic plan from 2018 to 2021. Nutrition is embedded in goal area 1, every child survives and thrives. And there are 3 specific results relating to nutrition, with the accelerated delivery of programs to prevent stunting, to scale up services for adolescent girls and boys, and when these preventative efforts fail, then to scale up treatment for severe wasting and other forms of severe acute malnutrition. And we have set ourselves the very ambitious targets which are laid out on this slide here to help attainment of SDG 2. And these are to reach 250 million children under 5 with services to prevent stunting, to reach 100 million adolescents per year with services to prevent anemia and other forms of malnutrition, and then to scale up services for children with severe wasting and other forms of acute malnutrition, reaching 6 million children every year. And we hope to achieve this by the end of 2021 every year. And these are very ambitious goals, but we believe, based on our previous performance during the last strategic plan, that we can make this reality. And this is drawing on some of UNICEF's unique strengths, primarily our mandate in human rights-based approach to programming, and our work in strengthening systems and working with national governments to drive sustainable change. And there are just a few points that we would like to highlight. And one is our strength in our workforce. We have over 650 staff working in the thematic area of nutrition globally, with our colleagues located where they're needed most. And no other agency, public or private, has this reach or this footprint. And we're able to bring these muddy boots to the policy table. We also, extending beyond that, can draw on our colleagues within UNICEF working in other sectors. And as I mentioned earlier, having a multi-sectoral approach to addressing malnutrition is absolutely critical. So working closely with our colleagues in health, in WASH, in social protection, and education, we can really drive and catalyze change. And again, extending even further to our partners, UNICEF at the global level co-chairs or convenes several key global partnerships in nutrition. And this is mirrored at the regional level and, importantly, at the country level, where we can bring stakeholders together to achieve results for children and women. And of course, this requires resources. And we have been extremely fortunate in the course of the last strategic plan in gaining the trust and partnership to increase our resources from 2014, when our global expenditures were 484 million, to 665 million at the end of 2017. But we project, in order for us to achieve our ambition for the next strategic plan, that we would need to continue this growth. And as I mentioned before, increasing the proportion of these funds that are thematic or most flexible will really help us to catalyze change, to fill gaps, and also to plan more strategically. We hope by 2021 that we can aim for global expenditures in nutrition at 850 million for that final year. And I would like, on behalf of all our nutrition team, to very much thank all our partners who supported us across our strategic plan from 2014 to 2017, especially our partners who have supported us flexibly, and specifically the government of the Netherlands, the government of Luxembourg, Canada, and the national committees of Poland, Korea, the United States, the Netherlands, Slovakia, Belgium, the United Kingdom, and Spain for their very generous support of our program. And we very much look forward to working with them in the future and the discussions and how we can shape our work in nutrition from 2018 and beyond to help achieve our shared goals and deliver results for children and women.